I'm delighted to see everyone here today. We're going to go ahead and get started. Let me make sure we're recording. Cancel. I just had to make sure we're recording before I got started. I was worried I might have hit a wrong button earlier. So thank you for joining us today. My name is Leacey. I'm a gerontologist with South Dakota State University Extension. I have Jane Strommen with me here today. She's a gerontology specialist with NDSU Extension. I haven't seen if Beth Dawkin from the South Dakota Department of Human Services has arrived yet, but she is supposed to join us as well. Mary Welts from the North Dakota Department of Human Services is also supposed to be with us here today. There she is. She just waved. She's with us as well. The four of us will be here to answer any questions you have about family, caregiving, or older adults. Before we begin, I want to go over a few housekeeping things. This session is being recorded. Jane and I will first provide an overview of family caregiving, tips to stay connected, and strategies to stay safe during the COVID-19 pandemic. If you have questions, please type them in the chat box at any time. We'll answer them probably when we get closer to the end. Following this session, we'll send you an evaluation. You will be invited to provide your contact information if you'd like to be notified about future events hosted by NDSU and SDSU Extension. We will not share your contact information with anybody outside of Extension. So I'm going to turn the microphone over to Jane.
Thank you, Leacey. Well, hello, everyone. Thanks for being part of this coffee break today. I'm going to start out by talking a little bit about family caregivers and why is it that we're focusing on them during this pandemic. And I'd just start by saying, family caregivers have a big responsibility on a normal day, any given day. And now with this COVID-19 among us, its effects on the people that they're caring for, whether they have a suppressed immune system or they are an older adult with, a chronic disease, is especially concerning for family caregivers right now. And with this pandemic, many caregivers, family caregivers, have been thrust into a caregiving role that they might not have done before, or it might be requiring some existing family caregivers to adapt in very new ways in carrying out their responsibilities. So it's kind of why we're focusing on that. And when we talk about family caregivers, I always like to talk about the different types of caregivers that are out there. We know that there's about 28% of all family caregivers are called family or the sandwich generation or sandwich caregivers. They're really caring for an aging parent and also raising their own children. And so they're balancing lots of demands, raising their children and dealing with their school and probably still in the workforce. And so they're working. Another challenge right now is we might have many unpaid family caregivers who are unemployed right now because of the uncertainty of the pandemic going on. So some caregivers live with those for whom they care, and others provide caregiving from a distance as well. So the role of family caregiving is really influenced by a lot of different factors, and just a couple of major ones are the age of the person that they're caring for and the underlying conditions of that person that's receiving care. So, regarding the unique circumstances right now of the caregiver, and they have underlying conditions, that's all unique, but there are some commonalities that they share. First is caregiving is always dynamic and unpredictable, and it does require caregivers to really frequently navigate unexpected crises with their loved ones. And second, family caregivers keep their loved ones at home, which really decreases the burden on the care system, whether it's the use of home and community-based services or other services. So really the value of family caregivers keeping their loved ones home safe and healthy right now is a huge thing. It's helping to not overburden their already stressed emergency rooms and hospitals. And so that value really can't be overstated right now. So when we think about what are the concerns that family caregivers might be facing right now with this public health crisis? Well, there's a number of things. The first one could be long distance caregivers can't travel to be with their loved ones. Maybe they're used to making regular trips and they can't do that right now. School and work closures may increase the challenges of caregiving, especially for that sandwich generation of caregivers. There may be a shortage of supply of home care workers, and that could worsen as this pandemic continues on. Respite care might be more difficult to obtain, and we're going to talk a little bit more about respite care a little bit later. There might be fewer people available to step in to be that primary caregiver if that need develops. And then for a loved one that is in a care facility right now, nursing home, assisted living, and you're the primary caregiver, it might be hard to continue with some of your responsibilities, whether it's visiting, monitoring, coordinating care. And lastly, just getting supplies for a loved one that might have some chronic illnesses might be more difficult, whether it's medication, food, other healthcare supplies. So thinking about all of those challenges, how can family caregivers be supported by during this COVID-19 period? There's a number of things that we can think about. Family caregivers really need to be an advocate for their loved ones' needs and really assure that they get the appropriate care that they need right now with somebody, a loved one with multiple chronic illnesses. Those things continue, pandemic or no pandemic, and they need to assure that the healthcare needs are met. And we know that telehealth has been offered by so many healthcare providers as a way for people to connect with their healthcare provider without having to leave their home. So being able to use that option is really important. Family caregivers really need to stay up to date on the facts around COVID-19 and from credible sources, like the CDC or our local state health departments. I know I'm inundated with social media, my emails, the news, all kinds of sources about the pandemic, and sometimes it's overwhelming and not always from trusted sources. It's important for caregivers to really know what those symptoms are and the warning signs so that they can contact their medical provider as soon as possible if it's indicated. Another thing that family caregivers could do that would be helpful is to assure that any prescriptions are filled and they have an adequate supply so they don't have to go out, or if their loved one did become sick, and any other supplies that they need, just to have those delivered to them as well. We know that support is needed for family, from family and friends to really help with some of this responsibilities of caregiving. And so it's really important that caregivers have a care team or kind of a care squad that they can know they can count on to carry out any backup plan or emergency plan if something happens. Who could you call on and what could they do for you in this situation? And then another important thing to plan is if the primary caregiver becomes sick for whatever reason and can't provide the care, or maybe it's a formal care provider that's coming into the home and they're sick, what is the backup plan? Making sure that you have thought that through. If you're working with an agency, maybe reach out to them and ask what are the backup plans if their staff becomes sick as well. So I think those are really important. We know that there is increased anxiety right now among everyone dealing with this pandemic, and I think it's really important for family caregivers to be able to talk with their loved ones about any concerns or fears that they have. We know that just being exposed to this virus for a healthy person can be scary, and certainly that is increased when somebody has compromised health. So being able to talk about those concerns and feelings are a really helpful way of dealing with a stressful situation. Another important thing to think about for family caregivers, if they are working, is to talk to their supervisor or the HR department and ask what kind of arrangements do they have for them to work remotely, or for them to be able to take time off if need to for their caregiving responsibilities as well. And then I think it's important, probably the most important thing is that caregivers need to take care of themselves. That we talk about self-care. Caregivers can feel overwhelmed by, constant and rapidly changing or conflicting information. So it's really important that caregivers take care of their physical and emotional health. And I just wanted to mention that, we have some programs in our states that are designed to help caregivers. One is called Powerful Tools for Caregivers, and that is a 6-week program. It's now for the first time offered online, and it's a way for family caregivers to get that education and self-care that they need at this time. So anyone interested in North Dakota could reach out to me. And then in South Dakota, it's Stress Busters, and correct me if I'm wrong, Leacey, but that will soon be available online. And I know that if anyone is interested in learning more about that, you could certainly reach out to Leacey as well. So, and then to be able to access respite care or family care support program in either states. And I know Mary, you're on, and I don't know if you just want to talk about respite care or the family caregiver support program before we move on to another topic.
Sure. In North Dakota, we just had a conversation this morning with our field staff. We talked about how the family caregiver support program could further support caregivers during this time. And if they have someone who can come in and give them a break, that doesn't always mean that they need to be leaving the home. Sometimes that break might be taking the care recipient into another room and just playing a game with them, or reading with them, or doing an activity with them, so the caregiver can just get that break, but yet be in their home. Or maybe if the weather warms up, maybe it's even just a half an hour walk around the block to just take that break. So for caregivers, with the Family Caregiver Support Program, we're encouraging them to think about things that they used to enjoy doing, and can those be done in other ways now? Maybe there's online, maybe book club can be done online if they used to use their respite time to go to a book club. Another thing that we're talking about with our caregivers is, like Jane mentioned, to obviously be thinking about the what ifs. And what we will do with the Family Caregiver Support Program is, if a caregiver ends up being hospitalized, and this is at any time, but especially now during COVID-19, and they're concerned about what will happen with their care recipient, we will authorize additional respite so that that caregiver can, if they need to be hospitalized or if they need care in their home, whatever we can do to help support that caregiver, so it's one less thing for them to be worried about in addition to their own health and in dealing with COVID-19. So basically it comes down to just, making those phone calls to caregivers who are in the Family Caregiver Support Program, and offering them the support, asking some of those tough questions of them. Maybe it's going to be finding someone to assist them with the technology. Jane opened with talking about long distance caregivers, and they may very well have an iPad sitting right there, but just don't quite know how to get into that Zoom meeting with their children. Maybe that is something our providers can be doing to support our caregivers. Mm-hmm. So we're certainly trying to support caregivers through this time, but knowing that the vast majority of them are not comfortable leaving their homes and going and hanging out at the grocery store, which obviously they shouldn't be doing. Most of them are taking social distancing to heart. So that's, we certainly are at trying to, I hate the term think outside the box, it's so overused, but how can we continue to support our caregivers through this emergency time?
That is great. Thank you, Mary. And I know Leacey introduced you earlier, but Mary Welts is with the North Dakota Department of Human Services and Aging Services. And I know Beth Dockin is also on from the South Dakota Long-Term Department of Human Services, Long-Term Services and Supports. And Beth, I don't know if you have anything that you want to add from South Dakota's perspective around family caregivers. Not sure if she hears me or not.
I'm not certain either. I'll send her a private message and see what I could do.
Okay, that sounds great. But you know, it's great that we have programs in our state that will help family caregivers, and sometimes people aren't aware that they exist. And I think this is a time more than any that we need to access all of the services that we know we have in our states to be able to help those caregivers keep their loved ones healthy and safe at home as long as possible. So thank you for that. You know, just as, you know, other people, not family caregivers, but if there's others, whether it's friends, relatives, or neighbors, and you know that there's a family caregiver there who's caring for somebody, it's important that we just check in on them, encourage them, reach out, support them, ask them what they need, find out if they could use a hand, whether picking up some groceries or picking up supplies. And we know that this social distancing can be difficult, but those caregivers really need that socialization and emotional support at this time too. So I think that's something that we can all do when we look around us in our neighborhood and communities and amongst our relatives, who's out there caregiving, and can we do something right now to really make a difference for them. Maybe this is a more difficult time for them. So
Jane, I've got Beth unmuted now. Let's see if she's got anything to add.
oh, okay, yes, great. Beth, just wondering if you had anything to add from them. Mary's talked a little bit about the services and perspective from North Dakota. Is there anything you'd like to add from South Dakota?
Yeah, thank you. Can you hear me now?
Yes.
Yes.
Oh, great. Well, hello, everybody. My name is Beth Dockin. I am with the Division of Long-Term Services and Supports here in South Dakota within the Department of Human Services. I appreciate the opportunity to join the call today, and I think you've shared some great information already. Thank you for that information from North Dakota. I thought that was great as well. What I would add here in South Dakota, we are working closely with both our caregivers and our home health providers, just kind of anticipating, you know, that we may have some situations arise where we need to call on, you know, whether it be the formal home health agencies to go in and provide some additional respite care for the caregivers. Certainly want to make sure that those caregivers are taking care of themselves, as was already stated. That's really important. And so making sure that they are taking that time, especially during this challenging time for everybody, making sure they're taking care of themselves. We are looking into some opportunities to provide some additional companion services, primarily, you know, over virtual technology. We're exploring some options, perhaps, of providing some of that technology for folks that may not have that readily available, so they can connect with loved ones, family members, and just really stay connected and make sure that they're getting that social aspect, especially during this difficult time where they can't be out and about and interacting with others. The other thing I wanted to mention was we have our Dakota at Home is our intake and referral network, and so that's a great way too if folks are looking for additional support. I would highly recommend that you contact Dakota at Home. That number is 1-833-663-9673. And I think Leacey did put that into the chat box, the website there. So that's a great number to call. There's some resources online at the website that she posted, but certainly that would be a great place to start if you or a loved one is needing some additional assistance. We're certainly happy to help talk through, what options might be available. We also have our lifespan respite program, and so again, if there's a need for some emergency respite or some additional respite for those family caregivers, that's another program that we can rely on to offer that and explore, some other services that might be needed during this time. So really a lot of different programs that we have available that we can utilize during this time to make sure that our family caregivers are getting the supports and services that they need.
That's great. Thank you for that information, Beth. And the North Dakota also has the federal lifespan respite care grant as well. And maybe just good, Leacey and I are gerontologists and we work with, midlife and older adults, but this lifespan grant that we have in both of our states is really to provide respite care across the ages. From very young to very old. So I think as you're on this call too, is to remember that we do have resources. So for not just older adults, but anyone who has some caregiving needs. So I hope I said that okay, Mary and Beth.
Well, and I will say that I also put the North Dakota Care Choices website in the chat box as well.
Yes, I saw that. Thank you. Okay. Well, thank you for that. And, with that, we kind of started just talking about caregivers specifically, but the other area that I wanted to talk about was just the importance of staying connected during this time. And we know that, heard so much about social distancing, and we know that this can be especially difficult for older adults. Or some older adults for sure. I wish that it were called physical distancing instead. We are very much social creatures, and we just need that connection to other people to be able to survive and thrive. So our social engagement with, really benefits our overall well-being. And now with this risk of infection brings the risk of social isolation and loneliness. And just to, highlight just the seriousness of loneliness. The research has shown that loneliness in older people can cause poor health risks such as cognitive decline, depression, and heart disease, just to name a few. So, older adults that are most vulnerable to social isolation and loneliness are, of course, those people who are living alone, our oldest old, those with no close family or friends, people who are homebound, whether they have health or mobility issues, or maybe they have a lack of transportation, and also people of lower income and less education. So those are our group of people who are more at risk. And just really being able to engage in some meaningful activities with others helps people be healthier. They live longer, they improve their mood, and they tend to have a sense of purpose, which we know is really important. So it's really important that we stay connected with our family, our friends, our neighbors during this time of physically distancing ourselves from others. So, everyone's situation is different. So, you figure out how do you do that? Well, I would say to older adults is, for them to take the initiative to keep in touch with their family and friends, whether it's the old-fashioned phone or sending a card, text, email, FaceTime. It's good for us to be good neighbors and check in with our neighbors and just have a friendly conversation. I think that's important. We know that we've heard a lot about Zoom meetings here and connecting with family that way, but this is a good time to learn that new technology, and it's maybe not as difficult as we think. That the FaceTime, Zoom, Skype, Facebook, Twitter, Snapchat, all of those options exist, and you don't have to be super tech savvy to figure it out. Sometimes it's just a friend or a neighbor who can call you and kind of talk you through how to get started. So there's ways for people to stay connected in their community too. I mean, I know that there's still opportunities to volunteer. I know many churches and other places are looking for people who will call on people who are shut in or are not able to leave their house. So that there are things that we can still do right from our home that really make a difference. For family members of older adults, you know, there's maybe a few things that I would suggest on just being able to stay connected. But the first one, it's probably, you know, very straightforward, but just being very intentional about making those contacts more frequently during this time. Challenge your family members to get involved and set up a schedule. You know, if you have a parent who is kind of shut in right now, get your siblings and your kids and grandkids and others, set up a schedule so that they're getting multiple calls or contacts or mail or a card or, you know, a picture from one of the grandkids on a regular basis, because I think it's really important to have more frequent contact right now. We know that face-to-face contact is best, but it's not always possible, such as now, but choices like FaceTime really helps maintain bonds when we can see each other. That's really important. Phone calls would be next best, because just hearing another person's voice is a form of social connection for us and can help. Some of those old-fashioned things, you know, making a gift, sending a handwritten card, those small gestures can really show your love and care. Promote those intergenerational activities, whether it's grandchildren offering to run some errands, check in with their grandparents. Those types of things are really important. Dropping off items that are important to the older adult in your life, whether it's newspapers, movies, books, other things that really interest them, just shows your concern as well. You know, and the last point is really focusing on those people who are living in our care facilities right now, nursing homes, assisted living. I would encourage you to contact the staff there. Ask them what technology do they have available for connecting with your loved one or the residents there. You know, I know my mom is in an assisted living facility here in Fargo, and they are able to FaceTime, you know, bring that iPhone into my mom and we're able to FaceTime. And so I think facilities are really stepping up and doing all that they can to help their residents connect with, you know, their family members. So, and again, don't forget about the old-fashioned mail and email as well. So with that, just to kind of wrap it up, there are some tips for all of us, regardless of what our age is, just to be able to kind of get through this time. And I think it's important for us to remember that we're all in this together. We're not alone, and more than ever, we need to find some creative ways to stay connected to each other. It's helpful for us to remember this outbreak, as serious as it is temporary and it will pass. So as much as we're able to maintain a sense of hope. And talking with our loved ones and friends about concerns and fears is really important. It can help us feel better to express those feelings. And last and probably most importantly is, if you're struggling or you know somebody that is struggling, you know, reach out to them, reach out to a trusted person, such as a pastor, a mental health professional, or a healthcare provider. And remember that those folks are still accessible, whether it's a phone call or a telehealth visit as well. So those are just a few general pointers that can help us all stay connected and feel a little bit better at this time. So, and besides staying connected, we also need to stay safe. So I am going to turn it back over to Leacey to talk about some home safety tips.
Thank you, Jane, for providing information to help family caregivers and those tips to stay connected during COVID-19. Megan shared that she's going to FaceTime with her grandmother tomorrow because it's her birthday and she lives in a nursing home. So we're glad that folks are taking advantage of that technology. And I feel fortunate to have the technology that we have today that allows us to connect in this way. So I'm going to review some of the strategies to reduce your risk of exposure to COVID-19, as well as reduce the risk of spreading COVID-19 to others. So there's some everyday preventive steps that we can take. Wear a mask when you're in public spaces where it's difficult to maintain social distancing. Many people who have COVID-19 have no symptoms, so you could unknowingly spread the virus. The following tips we've heard a lot about on the media, so I won't spend too much time discussing them, but the washing your hands, avoiding touching your face, nose, and mouth, staying home when you're sick, and covering your cough or sneeze with a tissue and throwing it in the garbage. That's the standard stuff we've been hearing about. So cleaning and disinfecting frequently touched objects and surfaces is also important. It's important to clean those surfaces with soap and water prior to using a disinfectant product such as Lysol or Clorox. If you don't have access to a disinfecting product, you can use diluted household bleach or an alcohol solution with at least 70% alcohol. Be sure to leave the solution on the surface for at least a minute. I'm going to send you information that's got this printed out in the follow-up email, but to make the bleach solution, it's 5 tablespoons of bleach per gallon of water or 4 teaspoons of bleach per quart of water. Limit the number of individuals that are coming in the home for adults that need assistance with routine tasks. Sometimes there's different people that will come in to help with personal care, such as bathing or to provide food. The fewer people entering the home, the safer the person will be. And if you live with a person who's at higher risk for complications from COVID, it may be helpful to shower and change clothing after returning from errands out of the home. With respect to mail, packages, food delivery, you want to avoid contact with the delivery person. With respect to packages or mail, you could leave those outside for a few hours or spray them with an aerosol disinfecting before handling. You want to dispose of all that outer packaging immediately and thoroughly wash your hands when you're done. Also, you can just disinfect those high-touch surfaces after you've collected the mail or the packages. So another key thing is, how do we prevent the spread of germs when caring for someone who is sick? I have a colleague that was kind of going through this recently, and it was pretty difficult for them, but first step is to have that person stay in one room of the house, away from other people, including yourself, as much as possible. If it's possible, have them use a separate bathroom. Avoid sharing those household items like dishes, towels, or bedding unless you've washed them. Have them wear a cloth covering that covers their nose and mouth when they're around people, including yourself. If the sick person can't wear the face covering, you should wear one while you're in the same room with them. If the sick person needs to be around others within the home, in a vehicle, at the doctor's office, they should wear a cloth face covering that covers their mouth and nose. Kind of revisiting that hand washing, this is probably one of the most effective things that we can do. Wash your hands for at least 20 seconds. Make sure you get all surfaces of your hands, especially after interacting with a sick person. If you don't have soap and water, you can't wash your hands immediately. Use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands when you're using that hand sanitizer and until they're dry. Again, revisiting that, avoiding the touching of your hands, nose, and mouth. Every day, just clean the surfaces that are touched often, like counters, tabletops, and doorknobs. Wash your laundry thoroughly. If the laundry is soiled, wear disposable gloves and keep the soiled items away from your body while laundering. Wash your hands immediately and remove gloves that you may have worn. Avoid unnecessary visitors. And then for additional questions about their care, consult their healthcare providers or state and local health department. So when do you seek medical attention? So there are situations where COVID-19 can be very detrimental. If you have trouble, if you or a person has trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, so basically get their attention, bluish lips or face, get medical attention immediately. Well, Jane and I hope the information we've provided so far will be useful to you and your family. We'd like to open the floor to questions, so please feel free to type your questions in the chat box. We did receive some questions ahead of time, and this first one I am going to turn over to Beth, and then I'm sure Mary probably will also be able to add some more. So the question is, what mental health services are available for elders? Beth?
Yeah, thank you, Lacey. So the Department of Social Services here in South Dakota works directly with several different mental health providers across the state. And so there is coverage across the state in every area. There is a community mental health provider that does cover every area of the state and offers services. So there is a wide variety of services available depending on, the individual's need. And if that's something that you're looking for or needing or a loved one is needing, the Department of Social Services certainly recommends people here in South Dakota access information on their website, which is dss.sd.gov, and then you would want to click on the behavioral health link, and that'll give you more information about what providers are available in your area and also more information about the services that might be available. There's also a 1-800 number that might be very beneficial for folks if they are, wanting to talk to somebody, if they're feeling, like they need to talk to somebody, they're just in a bad spot. That number is 1-800-273-TALK, TALK, or 8255. You can also send a text message. You can text the word hello to 741-741. So again, 741-741, and text the word hello. If you are needing somebody to visit with either over the phone or via text, please reach out to somebody. There are services available and there is help available during this difficult time and all the time, but especially right now during the difficult times that everybody is facing.
Thank you, Beth. Mary, is there anything you want to add?
No, it sounds like North Dakota is really similar. As we speak, I'm going to copy the link to North Dakota's Behavioral Health Division and their resources for COVID-19. So I would certainly direct people there. And in regards to caregivers, if they're caregivers of older adults, or like Jane talked about with the Lifespan Respite Care Grant, any caregiver, in North Dakota, we have the Asian and Disability Resource Link. So the caregivers certainly can reach out, can make their phone calls to our ADRL line as well, and they will certainly be, well, anybody could call there, and they will be directed to the appropriate behavioral health division people as well. But calling the ADRL is going to be able, that person will direct you specifically to people in your area who may be able to help you. But yep, the mental health of people through this is paramount. I think there's a press release, and I know that you probably have all heard this, but about the domestic violence that's been on the rise since the sheltering in place has happened across our nation. So we want to do what we can to get the information out about the resources that are available.
Awesome. Thank you so much, Mary. So the next question that we came in talked about senior clients have lost their taste and smell. What foods are nutritious for both their health and enjoyment? And I have two of my colleagues that are nutritionists on the line, so I was going to turn that question over to one of them.
I will jump in first, and then the other Megan can chime in. But yes, that is a great question. And everybody's different. Our taste buds are smell, they change as we get older, and everybody's going to be different. The main thing I would suggest is, keep trying all of their preferred foods and flavors, or even just enhancing those flavorings with different seasonings to see if they prefer that taste more. Another fun and different thing to try is textured foods. Try some fun textured foods, colorful meals to engage and kind of stimulate other senses when eating. And also, if they're not eating a lot at a time, their taste buds, they have no appetite, I would recommend maybe having smaller snacks on hand, because small meals may be a little bit more manageable and easier to do throughout the day. Megan, do you have anything else to add?
Hi, everyone. So another thing to consider with loss of taste and smell may be just the ability to detect if food has been spoiled or rancid. So that's another thing, is just if that ability to kind of taste of sour or the smell, if we open a package, we can tell if it's expired. So if you're a caregiver for a loved one who experiences the loss of smell or taste, it's important to really just check expiration dates on food in the refrigerator or in the pantry. And then if it doesn't have an expiration date on the package, just be really diligent about kind of writing the date that you open the package before putting it back in the refrigerator or the pantry. And if you need any information or a resource for finding out how long a certain food can stay good in the freezer, fridge, or your pantry, there's a nice and really user-friendly website that Leacey just dropped in the chat box. It was developed by the USDA, and it's called Food Keeper. So there's a couple of different versions. You can use it on online or on your computer, and you can also download an app for your phones as well.
Thank you, Megan and Megan. So the next question, we're moving through time so quickly, so I'll go ahead and move through our questions. So how do we approach the elderly about contacting them when they're frustrated about being cooped up and feel like checking in on them as being a pest? Jane, do you have any feedback on that one? How to not pester?
I guess I would approach it that you're not necessarily checking in with them, but you're reaching out too, because you're wanting to, friendly conversation, and maybe you're needing that social contact as much as they do too. So I think for anyone, for all of us, it's important to realize that we're all experiencing some frustration and the loneliness, or not being able to get out and about like we've used to, or we're not doing our routine. All of that can be frustrating, and for people to understand everyone's experiencing that, but make sure that they don't think you're just trying to check in on them, that you're also you miss them. You miss them, and you just want to reach out and visit with them, and it's important for you as it is for them.
Jane, I think that's wonderful advice to frame it as, I need this for me, as opposed to I'm worried about you. I think that's a really good way to kind of turn that around. Question about programming for seniors during COVID-19. Jane mentioned powerful tools, stress busting. Megan facilitates a program called Better Choices, Better Health that is going online. Are there some other examples that maybe I'm not thinking of for programming? Megan, do you want to unmute and just briefly introduce Better Choices, Better Health?
Sure. So we have a program like Leacey just mentioned called Better Choices, Better Health. And if any of you have participated in the program, you likely attended in person in a group setting. They're offered in the community across South Dakota. And now with the recent events of COVID-19, we'll be transitioning those workshops that were held in person to be delivered online via Zoom. So this platform that we're using today. So be looking for information on SDSU Extension's website for when we launch those. They should be available in about a month. And if you would like to hear more information or what the program all entails, I'll be hosting a coffee talk on May 5th.
Thank you, Megan. So our next question is, and I'm going to toss to Jane first. If you had to pick one area that is hardest for families right now, which would it be?
That's a tough one, Leacey. For me, I think it is just if you have a family member, a loved one, maybe in my world, I'm thinking about older adults who, you know, maybe they need some additional care and support, that not being able to be with them in person. I think that has been the most challenging, and that's why we're all talking about what creative ways can we stay connected to people. So for me, I think that has been the most difficult.
Mary, do you want to add anything?
I don't know that this is necessarily going to be the most difficult, but I think it is difficult for people when they're sitting in their home and they're hearing what's happening and they start thinking about the what ifs and don't know what to do, what if. And how do they, you know, how can they start those conversations with family who maybe doesn't live close to them, or family who maybe they've never had that relationship with their children where they feel like they can reach out to their child and say, you know what, I could really use my medications picked up, but they don't have that type of relationship with their family member. I read an article this morning on caregivers of someone with a cognitive disability, whether it's dementia or a younger person with a developmental disability diagnosis. And if they need to be hospitalized, and as their caregiver, as their advocate, you can't be with them in the hospital. And what happens then? Does delirium set in? Does it cause a healthcare of that individual to deteriorate even more so? And I don't think a lot of people are sitting around thinking about that, but this person who wrote this article was, and she said, you know, if a child cannot make a decision and a parent is going to be there with a child, so do people who are caregivers for people who have cognition difficulties, do we need to support them to be able to say, I will come and I will stay in this hospital room 24 hours a day. I will take some of the burden off of your staff. I will be there to make sure my loved one doesn't fall, to make sure that they eat, to make sure that, you know, that they have this familiar face. And like I said, I don't think it's something that people sit around and think about, but all of those kinds of what ifs that could happen sometimes start weighing in on people. Then that kind of leads to the behavioral health issues that happen as well. So I don't know, I just thought I'd kind of throw that out there as we're talking to people and just saying, you know, how do we encourage them to not look at the emergency plan as such of a negative as the piece that it could bring to them if they know that they have at least part of their plan in place if something were to happen.
Mary, that's a wonderful point, thinking about kind of what do you do in that difficult situation. So thank you for sharing that. Beth, is there anything you want to add?
Yeah, and thank you, Mary, for that. I agree. That was really good insight. I have to imagine it's very difficult for family caregivers right now to just maintain as much normalcy as you can, you know, just obviously given all the news that people are watching and the ever-changing nature of COVID-19. Of course, people want to stay updated, but specifically those family caregivers taking care of individuals with dementia, I think it's important to remember that the more calm and quote unquote normal you can make the day-to-day for those individuals that you're caring for, they certainly are going to be able to sense that. So if the family caregiver or the the caregiver in general, it's just important to take note of maybe your nonverbal communication. The individuals receiving that care, they can sense that, they can pick up on that. And so as a caregiver, be mindful of things like the sound of your voice, how you're speaking to them, your posture, the speed in which maybe you're delivering the care or doing the tasks. If they can sense that, you might be anxious or nervous, or, that there's a sense of, just if there's a sense of that anxiety, they're going to pick up on that. And so I would just kind of recommend to those family caregivers out there to just be mindful of that, try to, take a pause, take a step back, and just remember that your nonverbal communication to a loved one who may have dementia is really, really important, especially during this time.
I appreciate that reminder, Beth. Thank you so much. The next question, we've got about 9 minutes to go, is ideas or methods for teaching the elderly about video chat. I think really, from my perspective, the key thing on that one is whether or not the adult wants to learn. If they're not interested, they may not invest the time to learn, to use a new skill. If they do want to learn, but they have trouble, with technology, there are some specialized technology options that are made for older adults, like GrandPad, that may be a good fit. At the end of the day, it may just be like Jane said, asking that, staff person at the assisted living to bring the phone over so you can FaceTime. So it really, the key thing is the motivation of the adult to learn. If they want to learn, I recommend trying to teach them, and key thing, break it into small steps. Don't try to teach them how to run the whole thing at once. Just focus on the real basic steps that they need to, launch a video chat. And I'm going to apologize. My dogs are in the background. They've been good, but they're dogs. We had a question that came in about thoughts about chloroquine and hydrochloroquine, and whether or not we think that'll make a difference. I looked at some of the research on it, and that drug has worked on some viruses, but at the end of the day, Jane and I defer to the medical experts on the benefits of conducting trials to test the effectiveness of that treatment against COVID-19. So we had a question about pantry stocking essentials for families on a budget. Let me see, I thought Kim was here. Oh, she might have dropped off. So I have some links that I will drop in the chat box that provide some tips that for families that are on a budget and trying to, figure out how to stock their pantry on a budget. So I'll drop those in the chat for you. And then what are some of the ways to give older adults items that they need, keeping them safe to touch? Jane, is there anything you want to add about that one?
I didn't hear the last part of the question, Leacey.
Keeping them safe to touch. I think this kind of touches on some of what I talked about, but if you give older adults items they need, how can you safely give older adults the items they need?
Just from the cleanliness piece?
They didn't really specify. It just says, what are some of the ways to give older adults items they need, keeping them safe to touch?
Oh, I think you touched on that a little bit about, bringing supplies into the home, removing the outer packages, cleaning, those types of things. I really think it's, cleaning and disinfecting, frequently touched objects, and if it's, something that you're giving to an older adult that they want to use, make sure that it's been cleaned before you hand it over.
Perfect, Jane. Yeah, I didn't know if there was anything I might have missed, so thank you. I'm going to drop my email and Jane's email in the chat box. Does anybody have any questions that maybe they'd like to ask? You're welcome to unmute yourself.
I have one question, if no one does, just maybe for Beth and Mary too, just as we talk about keeping people safe in their homes. What special precautions are the respite care workers or the home care workers taking, as they're an outsider coming into the home of somebody that maybe has some compromised health issues? Are there some guidances being given to those home care providers?
This is Mary.
This is Beth.
Oh, yeah. Go ahead, Beth.
Oh, I was just going to say, we're really following the CDC guidelines, and so that's the guidance that we've put out to our home health providers, but they too are being very diligent. Several of our providers, if not all of them, are utilizing personal protective equipment as they're going into the home. Of course, hand washing, sanitizing frequently, but really utilizing the CDC guidelines and really taking extra precaution to make sure we're keeping everybody safe. I guess another thing that I would add to is some of our providers have scaled back a little bit on some of the services in which folks can go a little bit longer in between those services. For example, some homemaker services that our providers are going in and providing, maybe instead of 3 times a week going into the home or 2 times a week, they may be going in only every other week and maybe extending the period of time that they're in the home each time to make up for the more frequent visits. So really just trying to prioritize the needs of the individual. They're taking it case by case, but really trying to, only go in as often as necessary.
We're doing similar in North Dakota with the homemaker services, just really ratcheting back how often people are going in for the homemaking services. We put together an FAQ for our in-home providers, and it has just really good basic information. And then it also has suggested questions that we're asking our providers to ask, to make a phone call to the home that they're going to and ask the questions before they go in, so that they're kind of aware of any changes that may have come up. And I believe that I think they're probably just the normal CDC questions. Have they had close contact with someone with a lab confirmed COVID-19 case in the last 14 days? Have they traveled outside of the country in the last 14 days? Is there a fever? Has the individual been tested, or anybody in the house been tested? And are they exhibiting any of the symptoms? So that we have found that our providers have kind of appreciated having that kind of guidance as well.
Thank you, Mary. Leacey, did you see the question in the chat?
Oh, yes. So who is supplying the personal protective equipment for these visits by the staff, individuals or the providers? Mary, you want to start?
Sure. In North Dakota, we're directing them to their local public health agency for those materials.
Yeah, and this is Beth in South Dakota. We're doing similar activities. Our Department of Health has resources available, and so we're directing them to the Department of Health. Another thing I would add too that we're doing here in South Dakota, we too are making phone calls ahead of visiting, and our staff within the Department of Human Services, we typically go into the individual's homes and do routine assessments with them in person. We have moved those assessments to be virtual assessments, either telephonic or virtual, FaceTime or a video chat type scenario. And so we also are working closely with our home health providers for those individuals who aren't requiring, as high of a level of need or a critical need of services. And so we are scaling back some of those services. Our staff are jumping in and making more frequent telephone contact to those individuals, just checking in and making sure that their needs are being met, and that that we are staying connected with them. We're checking in. We're making sure that they don't need some of the services that we have scaled back a little bit. So we're making more frequent contact with our consumers that we serve as well.
Awesome. So we have reached the end of the hour. We thank you all for joining us. There will be another session on April 21st next week about personal finance. So keep an eye out for the registration for that. And we thank you all for your time today. You are welcome to email Jane or myself if you have additional questions that you'd like us to address.